Welcome to Change It Up Radio with Paula Shaw. We are so delighted to have you with us today. We're going to be talking about empowering women, and my two guests today are all about that. With me is Dr. Neysa Whiteman, who is a gynecologist, and she will be talking about how she works with women to help create happiness and empowerment through a healthier body and a healthier life. And Rosie Aiello is going to be talking to us about how she helps empower women to take their children and get out of toxic relationships. She herself has an amazing story of escaping from a very, very toxic relationship, and she'll be sharing her story with us in just a little bit. So thank you for joining us. Remember, live streamers, you're backstage with us here at Change It Up Radio. So this is not going to be a perfect production. You're going to see us chit-chatting a little in between segments, getting ready for the next segment. And who knows, you may even see some goofs. I've been known to say, oh, I really got to pee, forgetting that I'm on Facebook Live. So stick around. We're happy to have you with us. We'll be starting the show in just a moment. Okay. Thank you, Ms. Rosie. We'll see you shortly. Okay, Dr. Neysa, if you are ready, let me get my notes ready here and my glasses on. Ooh.
And this is streaming.
Mm-hmm.
Hi, people.
She's the best. Wait till you meet her. Okay, now when we hit this and then I do this little clap, then we're officially doing the radio show.
Okay.
Okay. Here we go. Welcome to Change It Up Radio with Paula Shaw. I am so delighted to have you here with me today because we're going to be talking all about empowering women. And my two guests today are Dr. Neysa Whiteman, who is a gynecologist here in Encinitas, California, and Rosie Aiello, who is working to empower women to get out of toxic relationships. So we're going to be covering the gamut today. So whether you're having painful intercourse or a painful discourse with your mate, we've got things to talk to you about today. So I first want to let you know that we are being brought to you by Tom Palladino's Scalar Energy Healing. And he is offering a free 15-day trial of this amazing cutting-edge healing method. And you can do that by going to freescalar.net. Free, SCALAR.net. All right, so welcome, everybody. As most of you know, I'm Paula Shaw. I'm an author, I'm a speaker, and I am a life transition therapist. And in my work, helping people go through life transitions, I'm always dealing with people who are dealing with pain. People whose lives have been turned upside down by unwelcome upheaval, usually resulting from change. Change is kind of the only constant that's out there, you know, and we whether we like it or not, it's happening. And so what I try to do is help people deal with their changes in a more productive way. I use the tools of energy psychology and a lot of mind-body tools because they help people shift those issues more quickly and with a lot less trauma than just years of talk therapy can do. I was originally trained as a talk therapist, but when I discovered the mind-body tools and energy psychology tools, and I saw how quickly they could help people change, I said, this is what I have to implement into my practice. So if you'd like to learn more about my practice or how I use these tools with people, you can get that information at paulashaw.com. Also, if you want to learn more about Change It Up Radio, or listen to some of our past shows, because we always have stellar guests that are bringing incredible information to people. You can find those shows and more information at changeitupradio.com. That's changeitupradio.com. Also on that website, you can get information about being a guest, being a sponsor, advertising on our show. There's all sorts of information there that could be helpful for you. This is a show for everyone who's dealing with change. And guess what? Everyone is dealing with change. So we try to bring information that helps people to make change smoother and more productive, to give them tools and processes so that they don't feel that they're just at the will of that upheaval, so that they just don't feel that they're suffering and it's a life sentence and there's no way out. I am also the author of this book, Grief, When Will This Pain Ever End? And I know that when that kind of pain comes along, a lot of times people feel like there's no way out. But there is. There is. Pain is kind of like change. It's a part of life. And it happens on every level. It happens on physical level, the mental level, the emotional level, and the spiritual level. And I think it's important for us to realize that there are tools. There are things we can do to help us with our pain. And that's part of what I do in my work. I think where Dr. Whiteman, who we're going to be talking to shortly, she's dealing a lot on the physical level, though I bet the emotional level comes in quite a bit too, because she's dealing with women. And in a bit, we're going to be talking with Rosie Aiello, who is definitely dealing with pain that women are going through on many levels, probably all four: physical, mental, emotional, and spiritual, in a toxic relationship. That's one of the toughest things we can go through. I think of a story of a client that I was working with who was having terrible for her, and she thought it was just a physical issue. But when we really got into it, she had been suffering from about a 2-year breakup with her son. He just took himself out of her life, and she didn't understand why. But guess what was showing up? A lot of low back issues, a lot of sleeplessness, anxiety. So when we looked at that, we looked at what's underneath it all. First of all, for those of you that know about the energy centers, the chakras, that's a root chakra issue. Family, connection to family often creates issues with the low back or the legs or the knees. So if any of you are dealing with that, look at what's happening in your life with your relationships and particularly your family. So it's, the mind-body movement has taught us all that it's not just one thing. It's not just physical. It's not just mental. It's not just emotional. It all connects together. And so like in the case of this woman I'm telling you about, she didn't just need to go to a chiropractor to take care of that low back issue or some other kind of physical therapist. She needed to heal the emotional piece around her son just sort of firing her from his life for no apparent reason. So we need to look at all of those pieces. And today we're going to be talking with Dr. Whiteman, who works with women in her gynecological practice. And I'm sure that she sees a lot of this kind of thing too. So let me tell you just a little bit about her. Dr. Neysa Whiteman, who, by the way, is my doctor, and I can tell you firsthand she's wonderful. She's board certified in obstetrics and gynecology. She went to school in Los Angeles at UCLA and USC, could it be better, and did a residency at Kaiser in Hollywood. When she moved to San Diego, she changed her practice to GYN only, and she's currently practicing in Encinitas. She's an advocate for women's health rights and enjoys the relationships that she has with her patients, and I can tell you she really is wonderful about that. She's particularly interested in the genetics around breast cancer now, what we're finding. We're going to talk to her about that. Hormone replacement, family planning, and contraception. And she has her own family, a husband and 2 children living right here in Rancho Santa Fe. So welcome, Dr. Neysa. I'm so delighted to have you here.
It's a pleasure.
Let's just get right into it. There's a lot of talk these days about genetic testing to help us figure out whether or not we're candidates for breast cancer. Can you explain that?
Well, actually, genetic testing is really the new frontier in health, one of the new frontiers in healthcare. And specifically that we're talking about women today, and certainly one topic women especially are worried about is breast cancer.
Absolutely.
It's very possible that at least 10% of breast cancer has a genetic predisposition. And so one thing that genetic testing has brought to the forefront for women today is the ability to identify some of these women who may have a higher risk of breast cancer before they get the breast cancer. And I like the term previvor. Previvor. Instead of being a survivor of breast cancer,
this is good.
I would like to prevent that woman from getting the breast cancer ever.
Yeah.
So if we can identify women that have a genetic predisposition, we can take steps to alter their care plan, offer advice, and different options for those women so that they hopefully will never get the breast cancer to begin with.
Go ahead. Is there a particular gene that we're looking for that tells us a woman's a candidate?
I think most women are familiar with the BRCA gene, BRCA1 and BRCA2. That's that was the first one that was identified.
I see.
But now when we look at genetics, there's actually panels of genes. And we can look not only at breast, but uterus, ovary, colon, melanoma, pancreatic cancer.
Really?
And in that bundle, identify women, because now there's not only the BRCA gene, but there's 11 or 12 genes that increase your risk for breast cancer. And so by identifying these women who have the gene, then we can intervene and hopefully give them a better outcome.
And if they have the gene, do you usually increase how often you see them for breast checks and that kind of thing?
Well, it's a three-pronged attack.
Okay.
So yes, the first thing would be increased surveillance, and probably starting in about 25 to 30 years old, screening women rather than 40 to 50. We have the opportunity to intervene medically in terms of offering medications that may lower breast cancer risk. And then there's the option of what we call risk-reducing surgery. Some women may choose to have a risk-reducing mastectomy, which would be different from a mastectomy for cancer because it's going to be cosmetically better. And in other words, the breast cancer just doesn't, if you get a breast cancer, it may not be in a place that is going to make that reconstruction cosmetically perfect. But a risk-reducing mastectomy can look great.
Good to know. And let's talk a little bit more about that when we come back from this break. We'll be right back.
All right. Well, that was easy. So that's the first one.
That's how easy it is.
So I'm halfway done.
Yeah.
That was it?
I told you it was nothing to worry about.
That's great.
Okay, let's just keep rolling. I think you're on a roll.
Are we staying in the same idea? Or are we starting with something new?
I want to ask you one other thing about that, and then we'll talk about We'll move on to...
We'll just move on to whatever you like.
Dyspareunia? Is that the right word?
Dyspareunia, yeah.
Dyspareunia.
Boy, talk about both ends of the spectrum.
Yeah. We're women. That's a great line. I might use it.
All right.
Here we go. Welcome back to Change It Up Radio with Paula Shaw. We are being brought to you today by Tom Palladino's Scalar Energy Healing. And he is offering a free 15-day trial of this amazing cutting-edge healing if you go to freescalar, SCALAR.net. And it's a very interesting website, by the way, everybody. He explains all about scalar energy, and it's fascinating. So take us up on that offer to get that free 15-day trial. All right, we are back with Dr. Neysa Whiteman, who, if any of you were not with us in the first segment, is trained at all of the best schools that Southern Cal has to offer, UCLA and SC. And she practices here in Encinitas in a gynecological practice only. She's not delivering babies anymore. But we were talking about genetic testing for breast cancer. And I find this fascinating. Boy, what a long way we've come. Because for so many years, we all went for our checks every 6 months or every year, hoping there was not going to be a lump. And we're doing self-checks in the meantime. But now Dr. Whiteman has told us that you can have a whole panel of genetic testing to tell you if you are predisposed to maybe have even cancer of other parts, the uterus. What else did you mention?
Well, we can do testing for any number of genetic diseases, but from a gynecology women's point of view today, breast, and the reason additional testing is important is because ovarian cancer, the same gene can run with the breast. So if you're at higher risk for breast cancer, you may be at higher risk for ovarian cancer as well.
I didn't realize.
And if we can identify those women, and when they're done with their childbearing, perhaps offer to remove their ovaries. Because breast cancer is well, I shouldn't say easily treated, but has a lot of treatment options today. But ovarian cancer, not so much. And if you identify a woman who, let's say the average woman has maybe a less than 1% risk of ovarian cancer in her life, and even with a family history may have a 4%, someone with a BRCA gene, for example, could have 20 to 40% risk.
Wow.
Which is like playing Russian roulette with a gun. But by removing those ovaries at a young age, but once they're done with their childbearing, you could have something like a 97% chance of saying this lady is not going to die from ovarian cancer.
And let me ask you this, Dr. Whiteman. How difficult is it to identify ovarian cancer? How do we find out if we have it?
So that's a lateral trade. So we're leaving the genetics and we're just going to screening women's
obviously
ovaries.
The genetic testing, it would be a smart thing to do.
So genetic
testing
is available, and it's family history based.
Okay.
So looking at your family history and identifying women whose family history is suggestive of a higher risk, and then screening those ladies. So we probably wouldn't necessarily screen everyone, but the women at higher risk. The second answer to your question is screening ovaries isn't that rewarding yet. When women come for their annual exam, typically a pelvic exam would be offered, and you can, in theory, your gynecologist should be able to feel your ovaries or do an ultrasound. But there's really not a really good screening protocol in place yet to identify early, for example, early ovarian cancers. It's not like doing pap smears to identify precancerous changes in the cervix or colonoscopy to identify precancerous polyps in the colon. Ovarian cancer still has a long way to go in that regard.
So is it painful? I mean, how is it identified? Does a woman come in and say, I'm having terrible pain in my abdomen?
No, typically that's the problem, is that it's not usually a pain complaint. It's usually more of a gastrointestinal issue. In other words, bloating, feeling full sooner after you eat. Your clothes aren't fitting the same way. It's a kind of a nondescript sensation that many women don't really identify as even being something they need to go to the doctor about until it really gets to a point when there's not a lot to offer. So finding an ovarian cancer early is really random, and many times just luck of the draw that we were looking for something else, and oh, by the way, that ovary doesn't look good.
Wow.
So because just if we screened every single woman who complained about bloating, we'd be doing a lot of screening to pass input to the gastroenterologist because it's probably just bloating.
Exactly. And I'm sure a lot of us would go for that thought first before we'd think, oh, I might have ovarian. And how is it actually identified? Is it a blood test? Is it a...
There's typically we start with a pelvic ultrasound,
Okay.
and that would show that something was amiss with one of the ovaries.
Okay.
And there are different types of blood testing that can help to suggest whether or not this might be a benign ovary or a cancerous ovary. But if there's any question, really the only way to know is to put the person to sleep and take the ovary out and send it to the pathologist. We don't.
Wow.
That's
I did
really
not
the final
realize
hurrah. Yes.
that we didn't have anything more definitive that said, yes, you have a tumor.
Well, we have imagings, ultrasounds, MRIs, CT scan, and certainly there are. If someone has an ovarian cancer, there are many indicators that looks cancerous, and certainly probably is.
Yeah.
But there are a lot of ovaries that it could be either one, and it could be benign, could be cancerous, but it's really not till that ovary's out that we can make the final determination.
You have opened my eyes. And this whole thing, I had no idea, and I'll bet you a lot of people out there don't, because, you know, if you don't have the symptoms, it's probably not something you're talking to your doctor about.
Well,
so I think
but that's going once a year and talking to the doctor.
So they need to have that checkup. And by the way, before I forget, let's tell everybody how they can reach you if they want to come and see you for a checkup.
Well, I am in Encinitas, California, on El Camino Real. And my phone number is 760-943-1011.
943-1011, and that's 760-760-943-1011. Or I'll bet they can Google Dr. Neysa Whiteman.
Probably would work.
Spelled just like it sounds.
Yes.
So not to jump right to the other end of the woman's body, but we women are concerned on many levels. One is our health. The other is our happiness. And one of the things a lot of women are experiencing, especially I think in that middle age range, is painful intercourse. Dyspareunia, I think, is the correct word, right?
Exactly, dyspareunia.
Dyspareunia. What is the problem there? What's the main cause of that?
Well, there's many causes of dyspareunia, as you've suggested with your woman or a lady with the back pain, there can be psychological aspects. But what's interesting is that there are a good number of women who have painful intercourse from low estrogen or hormonal changes with menopause. And what's good is that there are becoming more and more things that are available to women that are safe and effective. And more research to show that these products are safe and effective.
Oh, good.
Because
so are we talking about hormone replacement, or are we talking about something that actually is used vaginally? What do they use?
Hormone replacement is a term that can have two meanings. So yes, there can be hormone replacement for your whole body, and that will go by default to your vagina.
Yeah.
But majority of women are not really wanting to have total body hormone replacement.
Yeah.
And what they may or may not understand is that we can replace the vagina without replacing the body. In other words, we can treat the vagina now with different types of hormones without raising the blood levels so that it's safe. And in fact, we now have safety studies looking at thousands of women with breast cancer who are not supposed to have hormone replacement. But we have shown that they can successfully use different types of therapies, and including hormones in the vagina, that can treat the vaginal wall, make it thicker and more pliable, make intercourse more comfortable without raising their risk of recurrence.
That's good news.
It's good news for women with breast cancer, and it should be reassuring because there's so many women that are really suffering in silence because they're afraid.
Yes.
And they really need to talk to their doctors because typically the doctor isn't going to bring it up. And if the woman doesn't bring it up, then they don't get access to this information.
Yes. And that's so important. There's help for them now.
Yes.
There's help, and it's not putting them at risk of breast cancer.
And there's
or anything
more
else from the high risk.
non-hormonal options. There's even different types of laser therapies that are available for the vagina, so that a lot of women, if they would tell their doctor that they're having painful intercourse, and probably anywhere from 20 to 30% of women as they age gracefully,
Yes,
hopefully not ungracefully, have problems with painful intercourse.
Wow.
And rather than suffering in silence or just avoiding intercourse completely, there are a lot of tricks of the trade that are available to them.
All right, and that is one of the reasons I'm so delighted you were with us today, Dr. Neysa Whiteman, who you can reach should you want to see this wonderfully confident, knowledgeable woman. She is at 760-943-1011. That's 760-943-1011. And thank you so much for all this great information, Dr.
Thank
Neysa.
you. I very much enjoyed being here.
Oh, my pleasure. And we'll be right back. See, it goes by so fast.
It was really fast. I should have had you send it to me.
Well, you can't.
Oh, okay.
Yeah, let's do. Will you do one of us? Yes.
Yeah.
Well, and
But
Todd will do one
we're on
later.
Facebook right now?
Yep.
Oh, well.
We're having this now, Facebook. Yeah, we're live still. I told them that they were backstage with us. So we'll just do one like we're talking, and then we'll do one that's more posed. So there we go. We're having such a fun time. All right, and then let's do one where we're both just kind of leaning in so you can see your face.
All right.
Thank you.
Thank
and
you.
know what?
And I will.
Are you going to stay for her segments, or do you need to go?
I probably need to leave, I'm afraid.
So let's just do one more with your phone of us standing in front of the AM 1170 sign. Facebook will be right back. Can you do one more, Rosie, of her? Yeah, her and I.
Can send them to you.
Oh, would you? That'd be great. Yeah, that'd be really great. Because usually I take them with my phone, which is busy. Thank you.
All right.
Beautiful. Yeah, because I send them also to my Facebook gal, and then she'll send them. She'll put them on Instagram and stuff. So, Ms. Rosie, come and take the hot seat. Thank you so much.
Thank you. Thank you for inviting me.
All right, my pleasure. I'll be in touch.
It was really interesting.
It was.
Yeah,
It was
really
great. That was a lot of information that was new to me, too.
Oh, okay.
Oh, if you want to, yeah, let's do it right now. Okay, so we're still doing a few more pictures. Should we do one standing up first while you're standing? Stick around, Facebook people, because Rosie is going to talk about her story of escape. Okay. Okay, and now let's do one like we're talking.
That's exciting.
Okay, so we'll do one where we're kind of leaning in.
And I'm
first,
bumping
then
in.
we'll do one like we're talking.
Okay.
Okay, and now like we're talking a
Okay.
little bit. So you can move that anywhere. So
All right.
yeah, make sure your face is visible.
What we do.
Yes, what we do. All right.
Thank
Thank
you.
you.
That's
Dr.
really-
Whiteman is also a photographer.
Yes,
She does
we're
it all.
multi-talented women.
All right, so let me just get my
Thank you.
notes ready here.
Yeah, that's okay.
All right, I'll
Really
be in
enjoyed
touch.
it.
Neysa, take care. Bye-bye. All right. Okay, so live streamers, we are just getting ready to do our third segment with Rosie Aiello.
Mm-hmm.
And let me get my glasses on because this print is smaller than I'm used to. Okay, then we got my questions right here. Okay. All right, Missy, are you ready?
I'm ready. Sounds good. Mm-hmm.
Whoops. And welcome back to Change It Up Radio with Paula Shaw. We're being brought to you today by Tom Palladino's Scalar Energy Healing. And you can get a 15-day free trial of this amazing cutting-edge energy healing by going to freescalar, spelled SCALAR.net. All right, as promised now, I have with me Rosie Aiello, and I want to tell you a little bit about her before I start asking her questions, because she's got a lot of splaining to do. Rosie Aiello was trapped in an emotionally, mentally, and financially abusive relationship for nearly 25 years. She engineered an international escape from the Middle East to save her daughter and herself from domestic violence. Nearly mentally destroyed and stunned by PTSD within a few short years after arriving back here to California, her home state, she became a speaker, a best-selling author, and an internationally award-winning entrepreneur. With her program, she's now empowering women to find their voice, worth, and confidence so they can create a joyful, productive, and fully expressed life. What I think is particularly wonderful, too, is that working with her daughter, Sunny, they have created a new book that's upcoming called 11 Hours to Freedom, where they share their story of their journey of escape, freedom, and healing. But the two of them are now on a global mission to help save 1 million+ women and their children from being in abusive, toxic relationships. It's a big job. Oh, and they've also founded the Love is Kind network and Facebook group, so you can learn more about them there. It's a big job, Rosie. So tell us, first of all, I think it'd be wonderful if you shared your story with our listeners. What happened? Where were you, and how were you in that abusive relationship so long?
I met my my then husband in California at the university.
Oh.
He is of Lebanese. He's Lebanese. He's a Christian Lebanese, and we moved. He was already working in the Middle East. He was working in Saudi Arabia. So a week after we got married, we moved there, which I knew he was already there. Mm-hmm. So I lived about 12 years in Riyadh, Saudi Arabia, and about 12 years in Lebanon, Beirut, Lebanon. Mm. And, you know, when you get married or get into really any kind of significant relationship, you're not really thinking that that person is going to start putting you down and insulting you and really mistreating you. And you hear a lot about physical violence, you know, when they say domestic violence, the word I think of, oh, they're hitting me and stuff like that, and which obviously does happen. But this wasn't so much in my case. It was more subtle. It was psychological, and so it really created a lot of doubt. And why I stayed so long was multifaceted. One was, first of all, I was married 18 years before I even knew I was in an abusive relationship.
Really?
Because I didn't have the vocabulary for it. Or, you know, again, I was in the Middle East. I didn't hear things. And even though I had come to the United States to visit my family and things, I still didn't know. I kept making excuses that, oh, I'm just not a good enough wife. I'm just not enough. I'm just not, you know, kept trying to do better. So I didn't even have the vocabulary.
You thought it was about you.
I thought the whole time it was about me.
Wow.
And I have spoken to women here, even, you know, now that I've come back, who didn't know either. Mm-hmm. I've spoken to women who've been divorced for 12 years and didn't even realize that they were in an abusive relationship till they spoke to me. So it really lingers in. The other facet was in the Middle East, and especially in Lebanon, where we were right before we did the escape, is mm-hmm. that custody automatically goes to the father. It's not like you go to court and there's a custody battle or a custody discussion. There's no discussion. It's nothing. So until the child becomes major, you know, until they turn 18, the custody goes to the father. Mm. So I would have never, ever left without my daughter. Yeah. It was just, you know, by then I'd been married, 20 years. It's like, well, what's another 4, for her to finish her college mm-hmm. or something like that. It just did not enter my mind. It was like she was first. Mm. So I couldn't leave. And I know this is the problem with a lot of women is that they want to leave, they don't know,
Mm-hmm.
or they start to know and they can't leave. It's challenging. It's very, very challenging. So I have that empathy of why women can't leave when they want to leave.
The children is a huge factor. I think
Huge.
it's probably the number one reason women don't leave abusive marriages, because we worry about how will we take care of them, what's going to happen financially, if this man's already kind of a monster, how is he going to behave in divorce? So I'm sure, but the complications of being in the Middle East and cultural differences, I hadn't even thought about that. That's huge, because of course you couldn't come all the way back to America, and you might not even be able to communicate with your daughter if your husband had full custody of her, right?
Oh, yeah, for sure not. I mean, I've been back in the United States 9 years now. And to this day, he still stalks me. He still accuses me. He accuses me of brainwashing her and creating parental alienation and everything else, even though she was just shy of being 21 when we did arrive.
I'm curious, Rosie, what was it like living in the Middle East? I mean, we see all this stuff in the movies, and we certainly have heard a lot of negative things because everybody's so afraid of terrorism and all of that. What was it like for you, though, being an American woman in Lebanon?
I'm the kind of woman who really adapts to where I need to live. I mean, Lebanon was a lot easier to live in than in Saudi Arabia, which is more restrictive. But even though my husband wasn't kind to me, the Arabs as a population, and you don't hear this very often, are very, very generous in nature. They're very generous, and you may have heard about the nomads and people traveling this, the sands and everything, and come into my tent. It's kind of in their culture. So whenever you are with somebody, you're walking along the street, they'll just say, hey, they'll just reach out. They don't even know you. Say, hey, come on in for a cup of coffee.
Really?
Or you drop by a family or a friend, and and it's you've been there for a couple hours, and they just stay for dinner. It's not like here you have to call first. You have to what do you mean dinner? We don't have everything prepared. We always have something. So it was a really eye-opening, and the culture is really beautiful.
That's so good to know, and this is new information, I'm sure, for a lot of us. That sounds lovely, actually.
It is, and it is a very patriarchal society. Let's get real here, but there's a lot that can still be done. I was on, just to let you know, now this would have been, I don't know, maybe 30 years ago, I'm talking about at least. I was on a radio show by a Saudi woman. She had her own, she was the first woman in Saudi Arabia to have her own radio show, and I was a guest on that show a long time ago. So we still get things done.
We girls make it happen wherever we are, right?
Yes.
So how did you get away? Was there danger involved? Was this like something we would see in a movie, or did you say you were taking a trip to visit relatives here or something and just not go back?
He I shouldn't say never, but he rarely would ever let me travel by myself, and I never traveled with my daughter by myself. I never would just go to the United States for a visit. He just wouldn't allow it. And when my parents started to get older, I was allowed to go visit them. And you see the words I'm using, I was allowed, right? So we came to the United States, as I mentioned earlier, when we met at Berkeley. So we both had friends. And of course, I had family here in California. And we came here every summer to visit them. I was able to do that.
Okay.
But as a family, the three of us, it's like he never wanted me out of his sight. I didn't really put that all together until much later. And so was it dangerous? It's always dangerous when you're leaving an abuser, even though he wasn't physical. The longer we were married, the more abusive he came. And I was scared to death. And he also became highly abusive to my daughter. And she was the one who said, get me away from my father. That's what I was waiting for her, because, like I said, I never would have left without her. And so I was very scared. And one thing any of the listeners, I want to make sure is that you never, ever, ever tell your abuser you're leaving them.
Oh, good to know.
Because they'll put the controls on stronger. They'll make your life even more difficult, and it could be even they can accelerate the danger.
Mm-hmm.
Excuse me. So maybe maybe you read Viktor Frankl's book, Man's Search for Meaning.
Mm.
And in that, he shows how he got out. He got out in plain sight. He buried himself in a truckload of dead bodies.
Oh my gosh!
Right, that's how he got out.
Mm.
So, I engineered this escape in 4 months. I had 4 months to figure out what to do and how to do it, and I knew the only way out was under the guise of us going to visit my family in California.
Mm-hmm.
So we packed up as if we were just doing things, and my brother met us at San Francisco International Airport. I had already arranged for him to be there. My daughter and I took our suitcases and stuff behind him, and we left my husband standing and just said, we're leaving.
Oh, once you were here.
Once we were here, and
Oh
just turned away and left.
I'm getting chills, and we'll be talking more about this in just a moment when we get back from this break. We're here with Rosie Aiello. We'll be right back. So you actually flew here as a family and then just walked away.
I outsmarted him.
Oh my goodness, because he just never figured you'd do
Never.
it with him here.
And he never figured I would leave him, period.
Wow.
Even though there was lots of threats from him.
Oh my goodness.
Yeah.
All right, let's keep rolling here. All right. And then I want to get into what you and your daughter are doing and your foundation.
Whatever you want to do.
Okay.
I'm here for you.
All right. Thank you. Welcome back to Change It Up Radio with Paula Shaw. We are being brought to you today by Tom Palladino's Scalar Energy Healing, and you can get a free 15-day trial of this amazing cutting-edge energy-based healing treatment by going to www.freescalar.net. That's freescalar.net. And I am in studio with Rosie Aiello, who has been sharing with us her story of escaping a really toxic, abusive relationship that she was in for 25 years because she would not leave her daughter. And in the culture that her husband was from, he was Lebanese, the children would automatically go to the father. They were not living, obviously, here in America. And if you're just joining us, she just shared with us how they got away, which was pretty incredible because they flew here as a family. She had prearranged with her brother to meet her at the airport, right?
Right.
And right there, she and her daughter walked away from the husband with the brother and you told him, you're leaving, right?
Well, I was so afraid of him. I actually had my brother tell him. He walked up to him, because we stood behind my brother. I had my brother walk up to him and said, Rosie's been upset. It's like an understatement, but I was so terrified, upset, and she needs to have some time alone. I mean, I couldn't even say. It took a lot of, you're a therapist. It took a lot of work with a therapist for me to have the courage to even speak to him. And this is what I help women do now, is help them reclaim their voice, because it's been a long journey for me.
So tell us a little bit about the work that you're doing now with women. Who are you helping and what are you doing?
Well, I work with women who, they may not put it all together, that, why am I lacking confidence? Why am I not speaking up? And whether it's in a personal relationship or in business, why can't I ask for what I want? Why am I always playing small? Why do I always have to feel like, or I'm always being nice? We want to be nice, right?
Yes.
This nice syndrome. And we don't have boundaries. I mean, all this stuff. And almost all my clients have had some sort in their past, whether it was parental or, spouse or significant other, it could even be a friend, who were abusive to them.
Mm-hmm.
And they have just taken all this in. It's just gone into their subconscious. into their body. I know you know what I'm talking about. And they're not putting it together of why they can't keep advancing. And I talk to women, who are, even in their 60s, or their father was abusive or somebody was abusive, and they still can't get a good relationship. They still don't have that confidence. And that just breaks my heart because it's like, this is your life. You deserve, what one thing we always say, I always say is like, you deserve to be treated with kindness. You deserve to be able to share your voice.
Yes.
And you do that with kindness. You deserve to be able to ask and set boundaries that protect you without closing yourself off. And
But you were one of those women, Rosie.
yeah.
How did you get to the other side? What did you do?
I got to the other side by, within 2 weeks of arriving in the United States, I got a therapist. And I had to get, and I'm a big believer in it, and I got somebody who was in trauma therapy. I didn't even know I had PTSD. I didn't know what that was. Everyone hears it with veterans.
Right.
But we don't know how it impacts us. I mean, my brain was so messed up. I mean, I was like, just like I look now, but inside I was literally empty. I mean, I was so burnt. I didn't know what to believe, who to believe. And I've done, you name it, I've done that kind of therapy. I worked a lot on myself, from trauma therapy, speak therapy, to somatic therapy, to EMDR, to NLP, to, energy healing, the list goes on, tapping, and I do it myself. I work on it. I read about it. I have a huge library of books because I need to know answers. I was like a voracious reader, just trying to figure it out. And then to help my daughter through it as well.
Yes, because your daughter, I'm sure, was equally traumatized.
Oh, very much so.
Grew up, her whole life had been spent in that toxic relationship.
Exactly.
And people, I think, don't realize, and I'm so excited to hear you say that you have done tapping, you have done EMDR, you have done these other methods that work on hypnosis, another one, that work with the subconscious. So we really don't have to spend 20 years on the couch anymore, It's not like when Freud first started doing his work and you had to walk through every ugly detail of what had happened to you and hope that somehow there'd be a shift in your thinking or a shift in your behavior, a shift in your consciousness. Now we can do that in a much more targeted, conscious way.
Yeah, and just as an example, up until a year ago, I had the belief that I wasn't a good mother. And I had that belief because that's what he told me. He told me that for 25 years. He goes, "Oh, Rosie, I'm sure you love your daughter. I know you love your daughter, but you're not a good mother." So I heard that over and over and over. And it wasn't, it took a number of sessions of doing EMDR before it was finally cleared out. And I could fully accept that, okay, I am a good mother. I was a good mother. I am a good mother. And my behavior was, I was using survival skills that I knew. How I was handling the situation was the best survival skills that I could use. And those weren't even conscious either, right?
Right.
Even my survival skills were not conscious.
And it's an interesting thing that we're just learning now through epigenetics.
Yes.
We've been talking genetics on this show, that you inherited a lot of those responses genetically from the way your grandparents and your ancestors handled trauma, handled abuse. It isn't even all ours, We get that genetically too. So if we don't do the conscious work that you're describing that you did, we're stuck with that stuff we got from our ancestors. You stepped out of that paradigm and look at you now. Now you are in a position where you can help other people and you're driven to want to do that with your daughter, by the way.
Yeah.
So tell us a little bit about this book that you and your daughter wrote and the Love is Kind movement.
Yeah, we're writing our memoir. It's still in process. It's called 11 Hours to Freedom. And people, every time somebody told us, I told somebody about our story, they always said, "Oh my God, it needs to be in a book. It needs to be a movie." And he's like, "Oh." So finally I made the commitment to do that. And I decided, we were talking that, it'd be so good to have her in it because a lot of times you'll read books where it's about the wife and, and she's talking about her abusive husband. But I tell you, it's what happens to the children. So now you're going to see the point of view, not just only of the wife, but of a mother, what I'm going through from a mother's point of view and what the child is going through. So you really start to see the family dynamics and what abuse does and how it really destroys families. And I have to say, it's going to be the women who have to be the disruptors. We're going to be the ones who have to stop this. We're the ones that have to say no more. I'm not saying it's easy, but we have to change this and to move into kindness. And that's what we're doing, is that we created the Love is Kind network, because we believe, meaning my daughter and I believe, that love is kind and not terrorizing.
Amen. Absolutely. It should be. Unfortunately, what a lot of people are experiencing that they think is love is terror, is abuse.
Yeah, and I've talked to so many women that go, yeah, it's terror. You know, so I'm on a mission. You know, you heard my global mission. I'm also on a mission to end what I'm calling family terrorism.
I love that term,
it's like,
family terrorism.
It's like that's, you know, when you hear about sexual abuse in the workplace, it's not starting there. It starts at home. You know, it starts at home. And people make choices. I'm not, you know, your listeners are not responsible for somebody else's choices and behavior if it's destroying you. Right.
And you know what? Interesting. I was reading a book while I was on my vacation last week, and she was talking about how too often we're making decisions from our heart, and your heart is not the right place to make decisions from, even though it matters what we feel. But for example, you might stay in an abusive situation because you don't want to disrupt your children's lives, or you don't want to hurt him. Maybe so often abusive men have those I'm sorry moments, and they beg you to take them back. And we now make another choice from our heart instead of the right choice, and where a gut is telling us, this won't change, you need to go. And I think your message is so critical, Rosie. And again, would you give people the information where they can find you and again, the movement that you've started?
Yes, absolutely. So the movement is called the Love is Kind movement. So you go to Facebook groups. Make sure you go to the groups. It's called the Love is Kind movement. We also have on Facebook the Love is Kind network, and we have the loveIsKindNetwork.com. That's where you'll be able to start to find all the information about what we do.
loveIsKindNetwork.com. Beautiful.
Thank you.
Because I think there are probably a lot of people listening who are realizing they are in an abusive situation. I think you made an important distinction saying it isn't just about physical abuse.
Right.
You don't have to be being hit to be being hurt. If somebody can be really hurting you with their words. So thank you for pointing that out to us today, Rosie. Thank you for being here.
No, thank
you for this beautiful work that you're doing.
Thank you.
And thank you to all our listeners. We're so happy to have had you with us again. You can find us on Sunday nights at 9 o'clock on AM 1170 The Answer, on all major podcast platforms, on oh my goodness, everything. Just ask Alexa. We're out there in many places, and please check out and like our Change It Up Radio Facebook page and our Instagram page. So until next week, you all take good care of yourselves. See you then. Bye.
All right.
So live streamers, thank you for being backstage I forgot. Thank you for being backstage with us here on Change It Up Radio. I hope you enjoyed this show as much as I did. Two amazing women. Thank you, Rosie, for what you are doing out in the world. And we will see you next week with another great show to help you learn how to deal with change. Bye-bye.
Bye.